Still in the hospital.
Yeah.
No.
Okay. Just after. Yeah, we can call to order.
To the flag of the United States of America, to the republic which stands one nation under God, indivisible, and justice for all.
All right, I'll take roll. Vice Chair Dalton is absent. Committee Member Grants,
Here.
Committee Member Horton,
Here.
Committee Member Jones will be late. Committee Member Knowles,
Here.
Committee Member Schumacher,
Here.
and Chair Ray.
Here.
We do have a quorum. So next on the agenda is approval of the minutes. So if there's no discussion, I can entertain a motion and a second and a vote for approval.
So moved.
Second.
All those in favor say aye.
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 Okay, thank you. And then recognition of visitors. I don't know if there's anyone here who wants to come up and speak. You're just here. Okay, great. So then Chair Ray, I will hand it over to you to start with old business.
Alrighty, old business, the community resource list updates. I don't know that there's any updates that haven't already previously been shared. I think next it would just be moving forward with how we are going to present it to City Council as one of our things that we've done for the past year in our report, which is due before April, by April. Okay.
Around April 1st.
Okay. Is there anyone just chomping at the bit to present? If not, I can talk with council and figure out a time. Okay.
I volunteer Bob.
So then once you're comfortable with the status of the list, I can coordinate to get you on an agenda.
And then how should that be? I mean, currently I just have it in like a document. Is that something I would email beforehand or just bring with me?
Yeah, if you send it to me, I can actually attach it with the council packet so they'll have it in advance.
Okay. And I don't have any updates. Does anyone else have anything about the community resource list updates or anything?
I haven't seen the list because I was
you
virtual,
Okay.
so that would help me.
Yes. Okay. Send. I can do that. And then new business.
Yeah, so if you recall in the December meeting, there was a discussion of coming together and kind of re-examining the goals that you've worked on to date and then looking forward to the next year. But I know this was really Vice Chair Dalton's item. So if the committee would rather table this and bring it back at a future meeting, we can do that, or we can have the discussion starting today.
I definitely think that we can start the discussion. I know one of the things he did was bring the Western Union or Western University, the study that they had done, and asked that we review it and see if there's anything that we could even pull out of there so we aren't necessarily recreating the wheel, but looking back at what the city of Sweet Home residents have already said is needed. Is this, what is this?
Yeah, so if I might,
Yeah.
Madam Chair, he had asked, Bob had asked me to kind of go through, I went through the presentation and gave some feedback. These are not final at all. But what I had suggested was to evaluate the operating plan as it shows up. It actually shows up, I think, on the city website for 2019 to 2020. It was done then, and to make sure we come up with in the presentation of how far we've come, and then where we need to go from there. And I can give some extra feedback about that. I also wanted to emphasize, and it was part of what the students and Bob had zeroed in on, come up with some kind of community education forums. The suggestion being maybe quarterly. We could probably extend that or whatever. It would depend on, you know, what was going on at the time. My experience has been, you'll set it up quarterly and then something will happen right in the middle and you'd rather not put it off for a year. So the other was to make sure that we collaborate with Samaritan. I was hoping Wanda would be here so that we make a connection, hopefully to use some of their space for presentations. And if we can tie into them, it'll get the community to feel like they're part of the clinic as well. And then I wrote in finalize an ongoing resource list, which we just talked about. And it occurred to me after I had written this that, and I went back and put it in, to talk some about some media, social media links, particularly reliable ones, so that it's not just a list that we, you know, make up today and then worry about a year from now. You can actually have an ongoing media list, or the city council or the Chamber of Commerce might have something. It wouldn't have to be the complete list, but if these things are important to you, you can go to, again, it's something we can decide as a group. And then this has come up before, and I think it was part of the plan, just was not itemized, but Bob and I, when dealing with the health fair, have tried to tie ourselves to the dental van, mobile health van, et cetera. And it occurred to me it might be a good idea to figure out, we're going to have to polish this up because they've had some trouble themselves post-COVID and all, but come up with some kind of plan, visits to the community, and then post those visits, find a way to get them into the community, because we tend to tell ourselves, but we don't tell the churches, we don't tell the school. It occurred to me the high school, the kids would love to know when, you know, vaccinations were available and they could go home and tell mom, and, you know, all those things that we don't think of facetiously. I'll give you a copy of this. I wrote in the VFW, bars, et cetera. I mean, it's people who tend to not know. They're not dealing with Facebook or anything else, but probably need the access to the dental van as much as anyone else or more. So we can deal with that. And then it also occurred to me, I have a list that's not important to hand out to you, but I have a list of the folks who routinely come to the health fair. And I thought it might be a nice gesture, since we're kind of a formal group now, to invite some of those people to come in on some routine. We don't want all 40 of them to show up at the same night. And some are, and I don't mean less important, but they're statistically not so visual in the community, but there are some that it might be nice to have show up maybe every other year or something, give a presentation, show it, so it shows up for the city council that these folks are providing these services. Probably the council needs to know that. And that's kind of my list.
I think that FAC would be one of the resources that would be good to present at something like that.
Yeah.
We've been trying on our own way to figure out how we could involve the community and get more information out about what's going on at FAC.
Yeah,
and I think one of those types of things would be great.
Just to remind you, there's 40 some names on here that come to the health fair, but you know, we've got the teen pregnancy group, we've got the Love Inc. folks routinely show up. The Housing Authority, a major player in this area. Cascades Ride Line, major player in this area. Things like that. And, you know, we just have them come in and do a presentation and at least give Kelsey a way to brag to the council that we've talked to them and they should know about it. So, thank you.
Is there any more discussion on potential goals going into next year, or would you like me to carry this item over to the next agenda?
I definitely want it to be carried over to the next agenda, because I know Bob also it's pretty passionate about what our goals are gonna be. And I think just with him sitting on other boards in Sweet Home too, it's helpful to have that guidance of knowing what that kind of looks like, when you're making up goals to work with council on things. So, I would like to have it carried over and just, is there anything else that came from, reviewing the Western University presentation? I think the Community Education Forum is a big one for me because I think out of all the things that we learned that residents in Sweet Home are wanting, that would probably be the easiest ask to fill. You can't always find providers that want to come and stay in a small town, and you can't always bring in other services, but you can educate people on the services that are available to them, at really no or low cost. So I think that that would probably be the easiest way for us to assist with some of the things that were asked, is going over our resource list and maybe speaking with people or having someone. I know that there's a guy in the community that interviews people with like a lint roller brush thing and they just love him. So maybe he would want to come and talk with us and talk with some of our health partners. But just, I think that's one that would be very easy to add as a goal and attain that goal.
Back to the updating thing. I copied one out, but again, I would prefer to wait till Bob gets here, but we talked about this probably, well, my date is November of 2023, so it's a year plus. And we went through the goals of the previous and updated them all that. And I think maybe Bob and I could get together and we'll just kind of really polish that off and have a better presentation. Because we've done a lot, by the way. I slept through it, but it's a lot.
Okay, so I'll plan to have that on the next agenda as well.
Thank you.
And then moving on to the warming shelters item, this was brought up at the last meeting as well, just to discuss the need for additional warming shelters in Sweet Home. As most of you, I think we discussed last time, City Hall is available during normal business hours. The police department is also available. You can ask to be let into the lobby if it's freezing overnight. But that's kind of the extent of the established warming shelters from the city's perspective. So I think the committee was hoping to talk more about potential opportunities for warming shelters. Again, if you want me to carry that over, I can, or if you want to have the discussion today, we can.
I can add a little bit from the FAC standpoint, because a lot of the homeless people are the ones that are so cold out there. We do not have heaters in each of their huts. So I know that at night their sleeping arrangements are very uncomfortable. We are looking to add 0-degree sleeping bags so that at least that would, help keep them warm to some extent. We do have, in cooperation with the city, we have 13 new huts. They're not huts, 13 new pods that are coming in. They are very, very nice buildings. They're, I think, 10 by 12 or close to that size. They can accommodate 2 beds. They have heaters in them. Those, though, however, will probably not be ready for at least another 4 to 6 weeks, is my understanding. So for the homeless people themselves, that's something that I know they're all looking forward to. We do open up the community room in the facility at the old City Hall Annex is what we run out of. It was a donation from the city, and we greatly appreciate it. Half of it is office space and other stuff, and the other half is a pretty good size community room that is warm. It's heated, and people, the homeless at least, are allowed to come in at night if they so desire. Most do not. Most, believe it or not, stay in their huts, and they have blankets and they have sleeping bags, and those huts are designed. There is insulation in them, and I've not asked any of them how cold they feel, but I know when we interviewed the people in Walla Walla, it had snowed that winter, and they were living in 2 feet of snow in Walla Walla. And I said, well, how cold were you? And they said, it's amazing, these things, the way they're shaped, and with the insulation they have and with sleeping bags, they were able to sleep. He didn't say comfortably, but he said we felt much better than being in a tent on the street. And I guess that's kind of what I would say now. I think probably most of our clients at FAC would say it's better than sleeping out on the street. It's not as good as we would like it. We hope that, there are improvements with these new facilities. But bottom line is, I think that no one's frozen to death yet. We did lose a homeless client 2 years ago or 3 years ago, in large part to the weather conditions. He ended up losing 2 legs from being frostbite, and and eventually he passed away. So I know that cold can kill, and it's I think probably not a very comfortable way to go. So I hope that the community does take it serious, and that we do come up with not just options for the homeless, but it's amazing how many people don't have heat during this cold time period. There are a lot of elderly folks that have lost the heat in their homes, and it would be nice if there was some kind of an alternative for them, whether that be the churches, whether that be the senior center. I don't know, but I would really like to see us improve on what we have. Yes, we do have things that are open. Yes, they can go into the police department if they can get there. Personally, I think we need to do a little bit more. That's my own feeling. And I know I'm cold in my home right now, I'm cold right now. My feet are, and it's nice in here.
I also think some people having to choose between, am I going to buy groceries or am I going to pay my heating bill? I mean, I've been hearing a lot of seniors coming in saying my heating bill's gone up to $300, $400 a month. And one person came in and said mine was $900 last month. So, I mean, that's something that people are having to choose again. What's more important to me?
FAC staff last night gave a presentation to one of the church groups here in town, and I was shocked. And I spent a lot of time there, but I was shocked to hear that 60% of the clients are over 60 years old. 60%. It's not that they're drug and alcohol. It's not that they're not able to survive on the income they're getting from Social Security, and they lose their homes and they're out on the street. And at 60, I don't know. I don't know how they do it. Yeah, I've talked with a number of the people that are there. And I mean, there's one lady, 72 years old, and she lost her home. She lost her husband died, and she was out on the street because she didn't have enough money to pay her rent. So she's living at FAC right now. So, people think that it's just for drug and alcohol, and it's not. In our community, yes, it's significant, but it's not the only significant issues that we're facing. So warming, yeah, I think we need warming. We need to improve on what we're doing in the warming shelter area at this time of year. And I don't think it would take a lot. I think if we could talk with churches and different groups can you open up to some senior citizens for, from 10 o'clock at night till 6 in the morning? Get a volunteer to be there in there with them? Can we do that? Yeah. How many churches do we have in town? 27. Can you imagine if 27 churches were opening their doors on these cold nights for 6 hours, 7 hours? Would they be used? I don't know. The police station, I asked Jason Ogden, how much use does the police station get? He said, we don't. Yes, it's available, but we don't have people coming in there, which means that that's probably not where they really want to go, to the police station to get warm. But if the senior center was open, if there was a church open, would they go there? I don't know until we try it. But I think maybe we need to work on a plan to try it. Yeah, she'll learn.
So I will say I do get contacted by a handful of organizations every year asking to confirm community warming shelters. So as long as they communicate with us, then I can communicate that out to 211, for example.
So if there was a church that was available to be a warming shelter, they could contact you.
Absolutely.
And then how does that word get out to those who need it?
So again, those organizations that either host websites or folks call 211, as long as they have updated information, they will give them
They
the
can
full
give it
list of sites.
With 211. Thank you so much.
And I would think that we could put articles in the paper. I would think it seems like Facebook gets more attention than anybody else. But it has to be almost negative in order to get it in there. So, maybe we need to say something negative to get the ball rolling and, why isn't our town doing more? And boy, you watch, I bet you we'd have all sorts of information from the community. So who wants to be the bold one to put the first message on to Facebook? Maybe someone from this group needs to. Maybe it's, what else could we do? I'm not a Facebook person. I don't even know how to get on it. But maybe someone could say, the health committee would like to know, is there a need for, and how do we do it? What does the community think? And I bet you we'd start getting some, there'd be a lot bouncing around. I'd almost bet on it. Just a thought.
Is there something that we could send out to the 27 churches in town, like a form letter or something that says, hey, this is a need that we, as the health committee, have identified? How are you able to support with space? Are you able to support with food? Are you able to or wanting to support this effort? And what would that look like on your end? And see if we get anything back to see if there even is an opportunity to partner with them, and see then, now that they've offered this, what would they need from us to do this? Do they need us to help them find volunteers? Do they have an established list of volunteers?
My guess is we have somebody in this room right now that knows the 27 churches and can give us information to reach out to those churches.
I really like how you're asking questions, Chair Kelsey. I think that those questions and those ideas of like sending something to them, hearing from them, and then finding out what they need to make
Yeah.
it happen, I think they'd be most open to that kind of thing. A lot of times the church group gets told, you need to do this,
Yeah, totally.
and they don't have what is needed. So I think those are great questions. So if you put something together, you want to email it to me, I'll make sure it gets to all of the churches that we have updated emails for.
Yeah, that's fantastic on both of your sites. And I would have volunteered to do that, but I'm pretty busy right now with FAC.
Yeah.
There's a lot going on, and it's all positive, but it's taking a lot of time.
I'm a little concerned about relying on Facebook for people
Oh.
who are walking the streets and living. Even at FAC, it occurred to me, maybe you could get some of your FAC folks to ask some of the folks who are there over 60, how did you find out about this? The people I hang around with would tell you that it's the outreach people.
Mhm.
So that, once
Yeah.
we have more options, being churches or whatever, making sure that the outreach people have those additional options, that will get the word out. The folks who use the services talk amongst themselves, and it wouldn't take long before they knew the names of the churches or whatever. But I'm not surprised they're not using the police department, because
Yeah.
just saying the words make you cringe, and even City Hall is a uh, little overpowering. But the churches are a good idea.
Yeah, they are.
Yeah. So,
And I know that the senior center, I believe that the emergency services people are bringing in a big generator that is supposed to be available in case there are blackouts or, the loss of,
Yeah, it's not there yet.
but is that,
sometime in July.
Yeah,
well, I know it's probably not ready now, but down the road, is that an option maybe?
well, it may be. I think in the past they've opened the gymnasium and the Boys and Girls Club side. And so they had that available and you can set up cots in there. And I think we have a pod out in the parking area that has cots and things like that in there for emergency services. But
Yeah, and last year during the ice storm, the city did end up opening the senior center.
Okay,
No one came, but it was available. So we do have experience mobilizing that location.
good, okay. Yeah, the services are there if we have power. There's showers and cooking facilities and et cetera, et cetera. But if you don't have power, then it becomes almost a moot point. So, I just know every morning when I take my shower, I just thank the good Lord that I'm able to do that. And every morning I think about the people that can't do that.
can't do it.
And, what could we do to do a better job of it in our community? Over.
And I think the community needs list also just ties in with the warming shelters conversation in a way that there's things that I think we see that we need in the community, and there's things that we've heard are needed in the community. But how do we get that started? Who is going to take that on and spearhead that project? And I think starting that conversation with the churches as well, it's something I could include in the letter that we're sending out, that we'd like to know about warming shelters or cooling shelters, even. And then just the community needs list or some sort of closet. I know I spoke about how great the clothing closet is for the Sweet Home School District, but we have seniors who maybe they don't have anyone connected at all with the school district, and they might need access to hygiene products or clothes or other things. So I'll tie that in with the ask for the churches and see if there's anything that they could support, or if there's even something that's happening that just hasn't been widely talked about and we just aren't aware of it.
I do know that Carmen's Closet is at Shem, and I don't think you have to be qualified to get those things from Shem. So that's something that could be communicated. I don't know that it could handle the load that might be the community's needs, but it can be something people can reach out to.
Yeah, and one of the people that run the Carmen's Closet now, I put her in touch with young lady that's not here today, I forget her name. But anyway, with the feminine hygiene products. So they do supply that. They supply incontinence wear, and they have other things that we get donated, and they're cleaned and mended if they need to be mended minor, and then they're available. And there's usually a cart out front with clothes on it, so people can just roll by and pick stuff off, or you can come in and go through the closet and see what you need, dishes, and whatever else. So there's lots of stuff available there. We constantly get stuff in. So, but yeah, Shem definitely.
It's a good resource for that.
Yeah. They have jackets. The thing I was talking to Cindy about, the jackets and the blankets from last time. And she said sometimes people who go to one, like FAC, they get blanket and jacket, and then they go to Shem and get blanket and jacket. Then they go somewhere else and get a blanket and jacket. And so then the people who need them, who haven't accessed any of those, and they come, there's nothing left. So there's not a way to track who gets what and whatever. It's just,
Yeah.
the Cindy's down to 2 boxes of blankets. And then she's done. And I guess they need to be ordered or they're being ordered. But,
Well, I know FAC does have a wish list of items, and blankets are on there, sleeping bags are on there. And people do donate stuff. Problem is, a lot of times they donate stuff that is marginally usable,
yeah,
and then there's no place to store it, and it's probably not worth storing. That's the hard part is, again, at last night's meeting with this church group, what came out was toilet paper and paper cups. That there's so much money being spent on just toilet paper and paper cups that there's a real need, and for not just the homeless, but other people too. But those items are expensive.
Shem gives out a package to homeless people. They can come every week.
Yeah.
And it's a, like a shopping bag, but it's got those essentials in there.
Those things, yeah.
So,
So that list from FAC, can that be included in that email that's going to go out to the churches? Because I think there might be church people
I
who
could
could.
forward.
yeah.
I know the group last night was demanding a list.
Yes.
They wanted, how can we help?
Yeah, I think to
And-
know where what the needs are.
Yeah.
Specifically would
So
be
I'll
great.
send that on.
Well, and is that something that could be listed? I know there's like a couple places on the city's website that talk about FAC and what's going on there. And is that something that could be listed on the city's website for people to reference?
Potentially, I think the only issue we might run into, and this definitely came up this past winter, is we do have so many amazing nonprofits in Sweet Home. So we always want to be very careful not to show any favoritism.
Yeah.
But I'm more than happy, if there's a link on FAC's website, we can certainly put a blurb, hey, this is the website, check out their wish list. But we probably would want to stay away from maintaining a community nonprofit wish list directly on the website.
Yeah, there was a real positive story at last night's meeting that we had our one and only microwave oven died on us last week, and somebody, and I'm not for sure how it got on Facebook, but it got on Facebook that we were out and we went ahead and bought one and brought it in, and 5 minutes after we hooked it up, there were 5 other microwaves brought
oh my God.
to the door. And so Facebook does get around and people do watch, and it can be a very positive thing. We need a dryer. The dryer went dead also.
I
so
asked Candace to tell me what you're looking for, and she didn't respond.
if somebody wants to put that on the Facebook, we need a dryer that works. A working dryer. I guess I better stipulate that. Any rate, our community is a very giving community. If we just, anytime there's been a need, and I know when I was in the school district, we built that field, the football field, ourselves, and it was a $1.5 million project that we did it for $400,000 because of all that everybody chipped in to get it done. And that's just one example. I could go through a list of things that over the years I've seen in this community. You say you need it, you'll get it. So I'll get you the list though.
Thank you.
I won't send it to you.
I would like the list for myself.
Well, I'll send it to you, and I'll send it to you, and I'll send it to you. I'll send it to all of us. Yeah, whether you want it or not, and you can do with it what you will. Sorry.
And then I have a question. So I was reviewing everything that Bob had brought and talked about last time. And then I also went on the city's website and was looking to find just direction for what is this committee supposed to look like? Where are we supposed to go? Where are we going to take all this stuff? And so I reviewed everything that are the duties and the powers of the community health committee. And one of the things on the list is to review all community health matters that are referred to it by the city council. And I was wondering if that's something that we will start to see.
So we actually were just talking about
Okay.
this. So we do have a work session with City Council tentatively scheduled February 18th to kind of go over committees, committee structure. I think part of the issue historically is council has maybe not always understood their relationship to the committees, and that referral can be a part of the process, and it is a good way to get things out in the public forum. So all of that is going to be part of kind of this retraining session for council. So hopefully, yes, you will start to see some community health item referrals.
Okay, awesome. Thank you. Anything? Anything?
I would ask that from the seniors side of things, are you hearing anything that the seniors are asking for at the center? Or the needs that,
Well, we have more new seniors enrolling and coming in for our
Okay.
lunches. So and I have not been on Wednesday lunches lately, so to talk to people. But I know seniors, a couple of them have come in when I've been in this Aiden Center asking for the resource list.
oh,
You
good.
know, what
Okay.
things that they have questions, needs. And we have that booklet, the consortium booklet, but also the list that I gave you that we had that. And so we've been handing that out because people do have questions and
Good.
they have needs. But the biggest thing I've been hearing lately is their power bills. But I'm going to be there the next couple of Wednesdays during lunch. So I'll kind of go around and talk to people and see what they need,
Okay.
or what their questions are or concerns.
Yeah, I heard that the power bills potentially may double this next year.
Mhm.
I do know Community Services Consortium did have a pot of money where people could apply for assistance with their bills. It was so popular that they're putting it on hold for a month, but after a month, it will be opened up again so that folks can request assistance.
So how do they do that?
I can look into that for you.
Is CSE here yet or?
No,
Okay.
the other side is still unfinished, so they're not able to get going with operations yet.
It'll be nice to have them here.
Isn't Albany the closest?
Yeah.
Yeah, that's what I thought.
Yeah, and they're actually probably going to be dropping off a Connex of emergency supplies in our back parking lot in the next month. So
Any committee business for the good of the order?
Not for me.
so I don't know. I was talking with the mayor earlier. I might suggest canceling the next meeting and reconvening in 2 months because that will give city council the chance to have their work session. Right now, we're going through the process of having liaisons reassigned because we've had some turnover on council. So you may end up with a different liaison after next week's city council meeting. We'll see what the mayor decides. And then hopefully that will also give Vice Chair Dalton a chance to come back and be able to pick some of these things up. But that is totally up to you. If you want to reconvene next month, we absolutely can.
So how does that process work? Do you just assign someone or do you all discuss and ask for volunteers? What's the pro-
Historically, and according to the charter, um, the mayor has I don't have a lot of authority in the community. contrary to popular belief.
Yeah.
But one of the things is I can assign council members to community committees. I have had a couple of counselors who have requested certain committees. I'm going to reach out to the rest of them. I haven't heard from them. So pretty much if there's an interest in a
Get us a
particular
good one, would you?
Okay.
Thanks.
But
I
yeah.
think we're talking to her.
That would be wonderful.
No, I would like, that's why we were speaking is I would like to have the council in their input into some of these committees and more involvement. So I would like to hear from them. So that's why I'm looking forward to that February 18th meeting to hear from them regarding committees themselves, but also what are some of the goals they'd like to see regarding those. So
Good.
that's how it's worked before. I do plan to assign liaisons this next council meeting on Tuesday.
Good.
So as I divvy them up, you might see me again, you might see somebody else. So we'll see.
Okay. Yeah, I would be fine waiting until March for our next meeting to give the council.
I would vote the other direction just because Bob is not here. And we do have some work still to do with
Well,
goals and,
that's true. We
and
did
all of that. So my suggestion would be go ahead.
get the goal set.
Yeah.
Probably a good idea.
My suggestion too. I was like, oh, no one hate me, but I think we should meet again. If we're going, well, if someone from this committee has to present to council a report from the last year, I would prefer to not miss any of our meetings before that. So that I can get some sort of presentation together and present it to you guys first. And then it wouldn't feel so daunting to bring it to council.
Well, and I don't think there's anything wrong with both you and Bob
Yeah,
sitting there and
I-
presenting one.
I'm
you
sure
know,
Bob would
if-
be willing.
Yeah, I was going to say, if Bob's sitting there, you won't talk much.
Yeah.
Just
but-
introduce
I'm not
Bob.
volunteering anyone while they're not here, even
Well,
though that
I
is
was-
something
I
you would
actually
all
was-
do for me.
I think most of us could handle it. So
Yeah.
if push came to shove, we rather than have you up there getting shot at by yourself. But yeah, I think we should do the meetings as routinely as we can. We are a community meeting, not just the council. And, you know, we may only have one visitor and next time we have 20. It's, or what's the number, Adam? 88. It says on the door, maximum 88.
Okay, well, that's sufficient consensus.
Well, and if you don't have a person by then, I think we could make it one meeting
We'll just talk
with
about
just you.
If there's nothing else, then Chair, you can adjourn the meeting.
I'll move to adjourn.
Okay.
Second.